welcome to our webinar. I am Marcy Stoudt. If we haven't had a chance to meet yet, I am the co-founder of REVEL. And we always like to say we are in the business of leadership, and there's two things we do well: recruit top talent and build leadership programs where teams and leaders and cultures can thrive. And today I'm so excited because one of the best gifts of starting this company is we get to learn from people every day. So anytime there's something out there that I am curious about, or one of my clients is curious about, our go-to is let's call some experts and have a conversation. And then my sister and I, when we started this, we decided that we should almost never hold in our information. We should always have it public. So today's conversation, I'm excited to be a learner. I've got three great specialists. First, Christine Johnson is with us. She's a CHRO at a hospital at Baptist Pensacola. And she was the one that we were having a conversation just around the impact of AI. So we're at the stage now, we know AI is here. And we all know there's a tidal wave of change coming, but her questions were different. Her questions around like, what can I do as an HR leader to think differently about culture? And how should culture change decision makings and what should we expect? So what can I be doing today to think about the future within the next 18, 36 months? So I thought that was fascinating. So then we decided to kind of get some experts. So the first one we have Dr. Cassie Parker. And what I love about her background is she is a physician. She's got six years of clinical practice and experience as a practicing medicine, but she actually switched to go into project manager to help on some of the Epic implementations. So anytime you have a leader in medicine practicing with the patients that go to technology, it's such an awesome move for us as patients because you have somebody that actually has the patient in mind when you're making decisions with technology. And then we also have Dr. Mark Pierce with us. And Mark, I'm excited you're here because similar to Cassie, you also are a practicing doctor, still practicing, but went through the ranks and became a chief medical information officer at the top, kind of helping to make transformation of hospital systems. So both of you have a very unique lens. And I'm going to start with the first question, and then I'll probably go on mute most of this because I'm very curious about this conversation. But Mark, if you don't mind, I'm going to start with you.
Sure.
So from your lens, you've started your career as a physician and then you went to CMIO. So I think you've probably seen a ton of change because of technology. I would just love to know from your perspective, how has it changed the way hospitals operate and where do you think it's headed next?
Yeah, so great question to kick us off. And technology certainly has changed how hospitals operate. And to help us get our arms around that and even maybe to see where we're going, sometimes it helps to look back and see where we've been. And if you'll indulge me for a minute, let me go back just a little bit and take a look at that as kind of a platform to figure out where we're going. And I suppose you could say that technology made its grand entree into healthcare in the meaningful use age 15, 20 years ago. And that started this big journey from paper to digital. And that move was significant because with clinical decision support and clinical data, its goal was to fundamentally change the way decisions were made at the bedside and beyond. But at the same time, with that leap from paper to digital, it added friction in healthcare and in healthcare delivery. The UI of electronic systems and the EMR and the documentation and burden and such caused, a great deal of consternation amongst health systems and providers. And so once that big jump happened, we saw this coalescence from best of breed, multiple systems, departmental systems, into maybe this 80-20, 70-30 kind of coalescence into the few behemoths that we know, love, and recognize today, right? The Epic Cerners of the world. And I think after meaningful use, my organization, my prior organization, went from over 20 billing systems, three clinical systems, and dozens of departmental systems into just one of these behemoths as a go-forward strategy. So after this seismic shift in coalescence, the next sort of buzzword that came out with technology and healthcare was the concept of being data-driven, right? And because we transitioned from paper to digital, we now had all of this data at our fingertips. And gosh, wouldn't it be great to create some additional value with it and again, change how decisions are made into being data-driven, right? So how can we use data to drive our decision making in a more robust way. And almost similar to that original meaningful use piece, there was this other coalescence from the departmental reporting systems into the behemoth data warehouses that we've seen today. And so that's sort of in two big events, an oversimplification of where we've been. But what about where we're going, right? We sit on this precipice of this huge seismic change that AI will bring, right? The beginning of real AI in healthcare. And make no mistake, it is indeed a huge step forward, a grand innovation, and unlike anything we've ever seen before. Or maybe it isn't. You could argue that AI is just one more technology to fundamentally change the way that decisions are made in healthcare. Now, certainly it's more than that, and it does build on the paper to digital leap as well as the digital to data leap. And this time, the pressure is really on, right? There's no meaningful use dollars to back us up in case we make a mistake with implementing AI. And healthcare margins are under pressure that I've never seen before in my 35 years of practice. So as we take a moment to reset and prepare for smarter platforms in AI, I feel like as much as we're in a new place with AI, we're also headed into some familiar territory, and I hope to build that out a little bit as we continue the discussion.
Thanks, Mark. Well, we've talked about technology and implementation, and we've seen these intended technologies, these rollouts fall flat. So, Cassie, maybe you can talk a little bit about why this keeps happening.
Absolutely. So, I mean, I think that the biggest thing is that technology is just a tool, right? So medicine happens at the hands of the people that provide it, the nurses, the physicians, all of those folks. And if you just throw technology at them, it's not going to work. And to me, the biggest thing is that you need to involve those stakeholders early on, both in, adopting a new technology, but also as you're trying to implement that technology, like trying to think out how it will implement in certain parts of the hospital, and how end users will adopt it, and making sure that they're using it to its fullest potential. Because if you just throw technology at a bunch of physicians, they're just gonna not use it, honestly. And so really like making sure that they understand like this is something that we're doing to help you, and this is how it will help you, is really, really important in the process. And so making sure to do that. Certainly in AI, because I think that there's a lot of cross-eyes that go towards AI, right? Like everybody is a little questionable about AI and how reliable it is. So trying to make sure that we in before we actually roll out this product, whatever product it may be, ensuring that the clinicians, the nurses, the physicians, all of those folks really trust it, is really important, I think, in implementing any sort of new technology, but especially any AI technology.
Well, thanks, Cassie. I want to shift us into something positive that's coming out of this. So I've seen firsthand how ambient technology is reducing friction and giving back to our clinicians and being adopted. So what are some of the bright spots you're seeing right now, Mark?
Yeah, great question. I think there's a lot of good stuff that's already going well with AI in healthcare. And Christine, you highlighted one of the brightest shining examples in terms of ambient and AI documentation. And it's been amazing in its uptake and amazing in its benefit. But before any of us goes and breaks the bank and says, "Gosh, we should put AI everywhere in our own health system because of this one example," it might be worth spending just a minute to peel back the onion a little bit and ask in this particular case, especially ambient AI, because it is the poster child, the shining example. But before we ask ourselves, or we should ask ourselves, why is it successful? And I think that might help us understand at each of our own individual organizations what might be next. So one of the mantras as we look at AI in healthcare is to really stop before we look at AI as the solution and understand the problem. And I've often said this, and that is fall in love with the problem. Sometimes AI is the solution, sometimes it's not. But in the case of ambient documentation, let's think about this. This goes all the way back to that initial transformation from paper to the electronic world and that friction that was introduced in documentation, right? I don't think there's an organization in the US where one quote in the last 25 years didn't echo in the walls of, I didn't go to med school for this. I didn't go to MBA school for this. I'm not a data entry clerk. This is not what I'm supposed to be doing, right? And health systems, thousands of dollars into developing manpower to help with these solutions to smooth that friction, right? Smart phrases, shortcuts, macros, everything that Cassie does, right, is that important piece to smooth things over. And what's interesting is it just so happens that this ambient documentation problem sort of just fixes some of that friction. And I think that's why it's been such a resounding success. And that is that the problem was the right fit for the solution. Okay. So what bright spots might be next? Well, we hear a lot in organizations, for providers at least, that in-basket messaging is a big problem. So is that the next highlight reel for AI? And I'd say in that case, I'm not quite sure that it is, maybe, but the problem is so much more complex because this AI is so much closer to the patient and patient care. And there are all sorts of other issues that need to be worked out with AI in terms of reliability, liability, and human in the loop. So that's a possibility, but maybe not a likelihood. One place that really excites me that I think is probably next up and is sort of kind of a big deal is instead of large language models, using those in combination with AI computer vision and voice activated sensors in hospital operations. And I'd suggest, just for the education piece after this webinar, hit up class or whoever you trust in terms of technology reviews and look for smart hospital platforms. And I've seen some organizations do great work with this kind of technology, reducing falls, reducing pressure ulcers. I've seen organizations improve OR efficiencies and med-surg bed turnover efficiencies. And as we know from loving our problems so much, cost and efficiency pressures are right up there in healthcare.
So Christine, do you mind if I jump in with a question real quick?
Yeah, of course.
All right. So as a patient, I get fearful of the technology. And then as I'm listening to you and Cassie speak, I just kind of have this relief because you guys, it really is how do we make medicine and how do we make patient care better? And I feel this trust. And when we're preparing for this call, you were talking about falling in love with the problem. And I do love that just in business. If we could just fall in love with the problem, the solution could come. But when we were preparing for it, I was like, but what if the problem's AI? Like, what if the problem is actually AI? And Mark had the best answer. And it was pretty much like, because there's people like Cassie who has done this before, and you want to tap into people that have done this epic stuff before and this transition before, because it's just solving a similar problem with technology. So, do you mind, Cassie, just sharing some insight? Like, so when Mark was like, no, you need to tap into people that have technology, people like you that have done this before to have that fear around AI, not as fearful as I had before this call.
Yeah, absolutely. No, I mean, obviously AI is not perfect. We continue to see that in our everyday lives, but I think that it can be built with the appropriate guardrails in a healthcare setting so that it can be used in a responsible manner. And, any sort of these implementations of AI, there's heavy testing that occurs. And I've been part of that personally, and certainly like you're just making sure that anything that comes out of the AI, if it's even remotely near the guardrails, it goes to basically like a kitchen sink. Right. So like somewhere where somebody can go look at it before it goes into the washer. So I think that it's certainly important to be responsible when we look at any sort of AI implementations. But I do think that it's very um, most of the implementations of AI that are going on right now that I am aware of at least have a lot of guardrails in place to make sure that patients aren't being affected in any sort of negative way. And in fact, they're only enjoying the positive prospects of the implementation.
Marcy, can I jump in real quick? I don't want to make this sound like the Cassie commercial, right? But I am a huge proponent of a skill set and competencies that she and probably a group of individuals that are still in those who are listening, still in your organization, and I fear are untapped, right? So as much as AI might feel like uncharted territory, people like Cassie have been here before, and I bet there are people in your own organizations who have been here before. And if not, you need people like Cassie. What do I mean by been here before? They've understood the interaction of systems that fundamentally change the culture, how we think about the work, and how we make decisions, and have been able to take those systems and the workforce and meet in the middle so that they can be utilized and attain as much of their benefit as possible. And I'll be candid, it seems like back in the meaningful use days and the EMR coalescence days, there were a group of individuals and change agents who were hired by organizations to reduce this friction and get it right. And when I listen nationally, it seems like they're sitting on the sidelines for this new wave of AI when they should be at the tip of the spear. And I would make the argument that without finding those people for whom this isn't their first rodeo and trying to implement I won't go so far as to say as it will fail, but I would guarantee you that without a Cassie in your organization, you won't get the benefit from it that you could have otherwise. These are lessons learned, and we certainly need to lean on those as we go forward.
Yeah, I think that's huge because so often when we have a problem, we think let's hire an expert, but the expert in AI might not have it on the resume, but there are experts that know how to solve this types of process, things like that. So I think it's such a great point. I appreciate you making it. And now officially, Christine, I'll let you go back to your questions.
Yeah, sure. So Mark, you mentioned culture. And so with new technology, there's a cultural shift. And so maybe you can tell us a little bit about cognitive fit and how leaders should think about that.
Yeah, so I think this is going to be a key piece going forward. And when we look at technology in healthcare, and really technology is everywhere in healthcare, right? We've long had this mantra of people, process, and technology. And I think that framework has served us well over the years, but I think it's missing a piece, and a piece that's even more highlighted in this age of AI. Without paying attention to this piece, Cassie has seen implementations fall short of their potential benefit. It's known as the last mile effect, or end users not really fully using the system to its intent. And part of that shortcoming that is a great potential to be an Achilles heel in AI is cognitive fit. And the way I'd explain this is if you think about physical workflow, thought flow is cognitive fit. Thought flow is kind of a Kentucky cousin of the physical workflow. And I think it's going to be a big difference maker in the age of AI and certainly has implications for hiring in the workforce, right? Leaders need to understand that many, many roles in healthcare are indeed knowledge workers, right? And because they are knowledge workers, there are frameworks in our minds of when, of where, and of how we need to see information to make our best decisions and function most productively, right? And that's where cognitive fit fits in. And it jumps in as a critical piece for AI success. So, what do I mean by cognitive fit? To take just a second to get our arms around it. It's a lot, but as a starting point, I would argue, think of cognitive fit in terms of a four-letter mnemonic or acronym, TELL, T-E-L-L, trust, emulation, load, and learnability. So are AI systems trusted? Do they produce results that make sense, and are they consistent? Emulation, do they organize and think about knowledge problems like we do? And do they have the same values and prioritize the same critical human aspects in healthcare that we do? Load is sort of that human computer interface piece that we sort of already start to get our arms around. And in terms of learnability, look, you can't have a steep learning curve with these AI systems. And I think a lot of what we need in healthcare is the basic iPad functionality, right? You give an iPad to a newbie and it's seconds before they know how to understand it. If there's some sort of user manual out there that has 10 font and is 20 pages, you've got yourself certainly a big problem on their hand. It, and I think if we look at how AI impacts hiring, particularly, and more importantly, really more importantly, the successful, productive career of that hiree in healthcare, cognitive fit and adaptability of this coworker to the systems that you have in place, and ultimately how those systems promote the vision and, most importantly, the values of your organization need consideration. And I think because of that cognitive fit piece in terms of HR and hiring in the workforce, we need to think about hiring for proven curiosity, for proven thoughtfulness, for proven adaptability, even more than a skill set. Because in essence, what we're trying to do in terms of managing an incredibly scarce resource like the HR workforce is we're trying to use AI to upskill a certain group of people. And that's critical for hiring and the success of the future. At the same time, there's a risk of downskilling people who lean too much on AI and have knowledge, wisdom, decision-making wisdom kind of fade over time. So I think that's a cultural piece that we're going to be wrestling with, and there's a yin and a yang to it. In the short term, given the scarce resource that is the healthcare workforce, the concept of cognitive fit to your systems, and in particular your AI systems, so that we can upskill that particular group, I think is going to be a critical piece to continuing to maintain the care that our country is looking for.
And I think it's going to be really important in onboarding, right? To be able to like make sure in the onboarding process that you're sort of supporting those skills that are that curiosity and that adaptability and the enthusiasm to use AI as a tool rather than feeling like it's taking over their job. Because I think that that's going to be the big part, is making sure that it's helping people and that people aren't feeling hindered by it. And that's going to be a big portion of the onboarding process.
Yeah, I
And,
think
Cassie,
that's
I think you're spot on with that. And I think the funny thing is, in terms of hiring, for all of us involved in hiring, that's going to be a critical piece to tease out in the interview process. Because in this
Correct.
age of Chat GPT, you and I both know how CVs look and how they don't look and how it's tough to distinguish certain characteristics. And I think that's going to be a big shift is out of the written keyword-based CV into being able to understand some of those key pieces, Cassie, like adaptability and cognitive fit and fit for the organization. That's going to be critical.
100%. I agree.
So we've touched on hiring and onboarding. So maybe you could expand a little bit more on our current workforce. I have 5 generations that are working in the workforce right now. So talk to me a little bit about how we shift the culture for that group of individuals who are already here.
So I'll jump in on that first if you want, Cassie. And I think
Yeah.
when we look at that workforce and what is the potential for AI, the real question becomes how can we augment that group of current healthcare workers to relieve some of the pressures that we're feeling, right? From a clinical standpoint, you have physicians, you have nurses, and then you have care techs. Are there things that nurses are doing that a care tech backed and augmented with AI could do so that we can use them at the top of their license? Now, Cassie and I, being in the clinical realm, keep going to clinical examples, but I think the same exists in your revenue cycle. The same exists in hospital operations and efficiencies, right? How can you use AI to upskill or augment the current workforce you have so that everyone can operate at the top of their capabilities? And I think what's implied in that is very quickly we're going to have to understand and create mechanisms that basic comfort with AI is going to be a required competency for almost everybody, top to bottom in healthcare. And I think those are some of the pieces that we need to think about, and not just figuring out that youngsters that grew up with this are going to all of a sudden swarm healthcare and be that workforce. I think there needs to be a conscious effort of a lot of organizations to get a comfort level with this so that we can reap the benefit from it.
Yeah, and I think that really it's once again, like Mark said earlier, it's selling the problem, right? So it's telling people, we're bringing in this solution to take away this thing, this part of your job that you hate, that you don't like to do. You like to spend time with your patients. You don't like to spend time faxing or what have you, or rooting through faxes. And so I think it's really going at all of the end users that are going to be the folks that are going to be difficult adopters. They were difficult adopters of the electronic medical record, probably once upon a time. And now they're going to be difficult adopters of AI, and really trying to sell them on what we're fixing for them, rather than just the solution as a whole. And so I think that that's the most important thing, is just saying, like, this is what we're taking away from your life, from having you do. And all we need is for you to give a little bit of effort on the front end to learn how to use this tool, so that you won't have to do this other big headache anymore. And so I think that that's the most important part.
So I'm going to go back again, and this will be the third time I'm saying this in this webinar. When you look at what group of people in your organization have the skill set to lead a change management initiative, to talk to end users, to understand the technology and the implications for what it does in your everyday life, I would still beg of you to go back to people like Cassie in your workforce, even if it's in HR or supply chain that you're using AI. There is a group of people who has led your organization through a change initiative like this, because we've all been in the last 15 to 20 years through that paper to digital transformation. And that group needs to be at the table and leaned on to help get the value out of AI. Because again, to Cassie's point, if there's no buy-in and these systems aren't used or used to their potential, this is an investment that will not return. And we just don't have the margins to make that mistake in healthcare anymore.
Yeah, 100%. Agreed.
And Mark, you don't need to say it a fourth time. I might say it on your behalf, but I do want to just stay here for a second, because when you talk about the administration, understanding all the risks with AI and patient care, but all the benefits of preventing, there's one thing I hear all the time. It's physician, nurses burnout. They are just exhausted from the extra paperwork and all those types of things. So if there is an administrator on this call listening, as a CMIO, like advice would you have to them, speak directly to them in getting started with this? Like, how could they just get started with saying, what do we need to do and think about today for our organization's success?
Yeah, and I think this goes back to what Cassie said and what I've said, and that is fall in love with the problem. What are the problems, and what are the problems that are just perfect for an AI solution? And there are some that firmly believe that if you heal the healthcare workforce, you will go a long way to healing healthcare, right? And I firmly believe that. What are the burdens that are out there that AI can fix? So if you have anybody in your workforce that has a screen on the left and they are entering data in a screen on the right from the screen on the left, AI should be able to help you with that. In the clinical realm, we keep focusing on ambient documentation for physicians. To be candid with you, it needs to be pushed to nurses and therapists today, right? This is something that can help with the aspects of what we chose as our profession that are causing burnout and making us lose our love affair with making humanity better and healthier. And I think that's where I would go. And again, hate to sound like a broken record and repeat a couple of points a bunch of times, fall in love with the problem, understand where AI is the solution as opposed to pushing AI as the solution. And I think there'll be a great deal of success there.
Yeah. I think you mentioned when you talked about the ambient technology, I've seen, as I mentioned earlier, firsthand that it provides the clinician more time, better notes, and really gives them that sense that they're able to spend more time with the patient than they were before when they're inundated with charting and things of that nature. And so you do have those folks who are really interested and, to your point, have fallen in love with the problem and do want to see us move forward. And I do think you're right. They can pull those folks along in that process. They're able to sell the problem as well. So thank you both for sharing that information. It's really helpful. And so if you were giving me advice as an HR person in terms of everything we've talked about, what would be those first three steps that you'd say to me in terms of hiring for the future, hiring for the right person, using the cognitive fit, et cetera? What are those first steps for me?
So I think that the biggest thing is hiring somebody with curiosity, right? Like somebody who's open to change and is curious about new things. So I think that's number one. Number two is obviously this sort of plays in that, but somebody who's flexible, who doesn't need to be in like this tight fit role, but otherwise it can move around despite that. And then somebody who's going to take a leadership role. As we venture into any sort of time of change in healthcare. Mark talked a lot about the move from paper to EMRs. That was a big change. And then, moving up into the way that we use EMRs was a big change. But just like somebody who can drive those changes as we move forward, because I think that no matter how you look at it, uh, this is going to be a huge change in healthcare. Different organizations will implement AI in different fashions and to different extents. But no matter what, I think if you're not implementing some form of AI, then you're definitely running behind in the near future. So just having somebody who will take those changes and run with it and really try to get that out to the end users, I think is going to be really important.
Yeah, I think Cassie's spot on. So I think first and foremost, in terms of hiring for the future and for today, I think it's critical to find proof and evidence of continual learning. I think the days of getting a degree and thinking you know what you need to know for a career are gone. And I think if you look at how it feels like almost overnight, AI has changed the conversation in webinars, right? Or anywhere you go, if AI is not mentioned, you have to really ask, who are you? Where? It's the center of the buzzword bingo card, right? So let's
Very
be real.
true.
One other thing that I think is also critical to the success of AI is feedback. And so how would I translate that into hiring and questions and pieces to ask? If you look at the concept of owners versus renters, in the age of AI, if our goal is to keep our patients safe and our systems running most efficiently and effectively, we need people who take ownership, not people who rent and say, well, wow, the AI didn't make sense that time. I'm going to move on. But those who will hit the pause button, pull the ripcord, and say, wait a minute, what's going on here? And I think that's going to be an important part, especially where we are in terms of the timeline being at the beginning of AI versus these being mature systems. And I think anybody who tries to tell us that there are AI best practices is fooling themselves because it hasn't been out long enough for there to be a best practice. So we need that feedback from every aspect in healthcare. And I would argue it goes all the way down to laundry facilities and room turnover, all the way up into the C-suite. As we look at AI augmenting the workforce, we need to know when it's working well, when it's not working well, if there are issues with it, and what potential solutions are. So I think finding owners versus renters in terms of how they approach life, job, excellence in terms of what they are is going to be a key piece to get a really productive workforce in the age of AI.
It's awesome.
Thank
Well, the
I love
recruit.
that. Yeah, I think that that's a great way to kind of phrase it for folks that are hiring.
Yeah.
Perfect.
And then
Thank
the recruiter in me is thinking that is the easiest question to ask, like at all levels. Like, how have you not only embraced technology, but you owned how that technology is helping you do what you need to do, whatever your role is. But just having that, the cultural shift, if that is one thing from this, I mean, that's a really interesting thing to start in the very beginning, no matter where your hospital system is. All right, so I want to change gears for a second, and I still want to do like the fun wish list. So I want to ask each one of our panelists a question. So if you had the magic wand or the wish, like from your lens, the future of healthcare, future of work, what's one small wish that you hope technology or AI can do in your world? So Christine, feel free to dream big.
you.
It's a
Well,
magical AI, just like AI is for us. But what's kind of something for the HR world? What's your hope?
Well, when I think about culture, and involving our frontline staff in the conversation and in the creation so that they're a part of the solution in the future would be my wish in everything that we do, whether it's at the bedside in HR, because a lot of times we make that decision here, we build it here, and then I think we talked about how we roll it out or push it out. And so that we would involve folks the other way, right? From the very beginning. That would be my wish.
That's awesome. So Cassie, I feel like you probably have a comment or thought around that wish of Christine's, but after you comment, I'm going to ask you the same question. Any thoughts, Jen?
So mine is not a small wish. It sounds a little ridiculous. But honestly, my involvement in AI at this point in my career is trying to bring the joy back into medicine. So, like, medicine was a second career for me. I didn't go to med school because I wanted to make a bunch of money. I could have made more money doing it, the doing whatever like consulting that I would have done otherwise. Um, and most people are that way. They go into medicine because they love it. And then you find yourself just spending hours doing chart reviews and documentation and so on and so forth. And I think that AI has the capability to remove a huge amount of those administrative burdens, and to really bring back the love of medicine, to people that's what they went through all of this for. And so I'm really excited about that, and that's the reason why I'm, pursuing AI as one of my post clinical time goals. And so I really hope that we can, as unmeasurable as that is, achieve that is bring back a little bit of the joy of providing medicine to providers.
Oh, that's awesome.
I
I
love
love
that.
that.
I love that. Yeah.
You could hear a lot of clinicians listening to me like, Please. And I know, Mark, for you, you had, you have an opportunity. As you left your organization and you're out there, you're doing some virtual doc call, and you're saying you've never been happier because you're just practicing medicine with the patient. You're not doing that, the stuff that Cassie was just talking about, the frustrating paperwork and all that stuff. You're just actually serving your patients, which I know is something you probably share with Wine and the Joy. Any comments on what Cassie was sharing? And then I also would like to hear your wish.
Sure, yeah, I totally agree. I think in a general statement, I would love to see the future that's AI enabled that really heals the healthcare workforce, right? And it does bring the joy back. And if I could get very specific in terms of what my one wish is, and I've checked and my magic wand is out of pixie dust, so I'm not going to be able to pull this off tomorrow. Um, in healthcare delivery, there's this yin and yang, push and pull of finances and of patient well-being and improving health. And I think if we could somehow, in my world of rainbows and unicorns, get payers and providers to agree and share AI platforms to potentially eliminate the ping pong of you need a prior auth for this. Nope, the AI said I don't, and we agree that we're still all using that one AI to function and deliver together. If you think about how that could remove prior auths, how that could eliminate the ping pong of deny, resubmit, resubmit, deny, reclaim. If we could eliminate that, if you take that out of healthcare, how much better would we be? Instead, at the moment, we seem to be in this AI arms race where we have one company selling to providers, hey, here's some AI that will help you upcode, and that same company selling to payers and saying, well, here's some stuff where you can detect goofiness. I mean, in my dream world, we share the platforms, we eliminate that administrative overhead, and we start focusing on the societal well-being of raising the bar of health and longevity and enjoying life, which, as Cassie mentioned, is why most of us got into this business in the first place. So if I ever get restocked with pixie dust, that'll be the first thing I wave and hope to happen. But that's probably a little bit of a ways off, huh?
Yeah. All right. Can we stay on this for a second? Because I think I just want to understand it. First of all, your wish sounds awesome because my wish is to not have so many papers on my desk being like, wait, I thought I paid that bill. And wait, that doesn't line up for this. Which kid was this service for? Like, that's my way. I just want that to go away. I don't mind paying. I just am so confused on what I actually owe. But are you saying, so let me just understand. So with the payers, with hospitals getting paid, you got to go through insurance, you got to go through the patients, and there's that whole process. It's not through Epic. I always think of Epic going live at the doctors that I go to, and now at least my patient records are a little bit more consistent. But are there different platforms being sold that maybe my doctor's office can't talk to my portal?
Yeah, I think in my dream world, what I'm really talking about, Marcy, is if we have ambient documentation at the front lines and what it captures, there is a single AI model and conglomerate of models that are consumed to where that LLM says, here's what I heard Dr. Pearson, his patients speak of. And from the payer side, they're using that same platform and same modeling and say, well, based on what the AI says, this is a level 3 visit, right? And here's what we're going to send Marcy as a bill. Similarly, for a hospitalization, these are what we hear going on, what we see going on. Is this really sepsis or is this wink, wink, a sepsis upcode because it might qualify for sepsis, right? So that we have a clean database, we have clean expectations, and we're operating on the same level playing field. So it's not the organization saying, hey, I should upcode or downcode this to sepsis or not. It's that the payer and the provider have agreed that these are the criteria to diagnose sepsis. We're using the same LLM, the same AI infrastructure so that no one can cheat the system. And so we just agree that these are the ground rules we're going to play with. Similarly, you could apply that to prior authorizations and other things along those lines. Just eliminating that so that there is one unified AI platform. So to answer your question directly, yeah, there are platforms on the payer side that, some of the big commercial payers have that we never see through Epic. And Epic and some of the other big players do have initiatives to kind of share data nicely in a let's play nice together platform. I don't think those have advanced as quickly as all of us would like, but at some point, I think that's the dream state that could eliminate that hassle and ping pong and the nightmare as it comes back to patients, right? So my insurance paid for this. Well, no, they didn't. They denied that. I'm responsible for it. Well, no, you're not, because we're going to appeal it. To get rid of that nightmare and to use AI to say this is what we've all agreed on and provide it to a level playing field, I think that's something within the realm of capabilities of AI in the not too distant future.
Yeah, I think as a summarization, so basically organizations that use Epic, their claims are processed through it, but it's not like the insurer has access to Epic, right? So the idea would be that if we can have these AI platforms that both the hospital and the insurer have access to, they're literally seeing the same thing rather than it being like a little bit of a translation. And so I think that that could simplify things to a great um deal as Mark is speaking to. So I think that basically like these, especially because they of the way that these AI platforms live, it is reasonable to expect that both the insurers and the hospitals will have access to the same platform and be seeing the exact same thing rather than some sort of translation.
I think we
Again,
need
that's a
to,
dream state, Marcy. Or
yeah.
Christina, it's a dream
I was,
state, right?
I was just thinking we need to get you some pixie dust for sure to make that come to life, to really take away that tension, right, between the caregiver and insurance and all the other pieces of it. So yes, and to bring back the joy, as Cassie mentioned earlier. Yes, love it.
Well, I love this
Just a
conversation.
little goal.
A
Just
little,
a
a little
little.
goal, but it's coming. Like I feel like, again, we're gonna close out this conversation, but I would love to hear like a final word from everyone. From my end, getting to know you all and learning about this, I just feel like the one thing I've gained is less fear around patient care, and that good things are to come because you got leaders who actually care about healthy solutions for patients, really out there making decisions. And I'm not sure I saw that as clearly as I did until we started having these conversations. So thank you for that gift to me.
Yeah, thank you. It's been a fascinating conversation. I think you've opened my eyes to some of the challenges that we may be facing and some solutions that we can employ that will help us as we transition through this process. So thank you both.
Yeah.
Pleasure.
Cassie, I'd love to hear any final words or
I
anything you want to
mean,
share.
I'm just going to reiterate, like I just think that some of these tools are something that as clinicians we need to embrace. I think that there is a natural fear about AI, but I think that it can really take away a lot of that administrative burden and make it to where we can do the things that we love to do and make us better at it. Right? If we're focusing on the things that we love to do, we're going to be better to ourselves, we're going to be better to each other, and really make healthcare a better place to be and what we wanted to be in the first place. So that's my ending wish.
I would probably finish up by saying, as exciting and as brand new as is AI, also remember there's really nothing new under the sun. And this really isn't the first rodeo in the last 15 to 20 years for trying to dynamically change how healthcare delivery and healthcare decisions are made. So, as much as we need to go into this with wide eyes and eyes wide open and with awareness, I don't think it needs to be fear. I think there are great lessons learned over the last 15 years. And if we are astute and pay attention, we will make mistakes, but not the same mistakes that we've made in the past. And so I think that piece is critical to understand. If there is some expertise in the critical implementation of AI that already exists in your own organization, leverage it.
That's wonderful. Well, again, thank you so much to our panelists for being here and for Christine for bringing this conversation to life. I think it was a great question and then a great conversation. And for everyone that joined us, we hope you enjoyed this, and I hope you all have a great day.